and I think what you said, building on what you said about we needing guidance on how we can measurably move the needle. So that's what we're focusing on now, this evidence-based guidance. And there's some, I don't have time to share all, but I'll share three things that these bright spots are doing to adequately represent groups. One, they're not working with vendors, right? They're shifting away from vendors. They're pretty disenfranchised. They're disappointed with the vendors who came in promising to be able to, solve everything and take a one-size-fits-all approach. They're doing a lot of it in-house and working very closely with patient, nurse, and lay navigators in person at each site, right?
Let me interrupt real fast.
Yeah.
When you say vendors, do you mean patient equipment vendors? That type of vendor, or are we talking even CROs?
That's interesting. Yeah, I didn't ask if it was a specific CRO that had come in to prompt,
Okay.
but
Okay.
outsourcing essentially.
Okay,
Outsourcing.
perfect. Gotcha. Sorry.
Or digitally using some digital tools.
Okay.
So really working with patient navigators and local community health workers, that was seen as a factor for success. The other one was better leveraging the existing site infrastructure. This is not a panacea, but it's a good bridging strategy. So where do we know that oncology trials, for example, take place? We know that they take place often at large academic medical centers in major cities on the coasts, right, of the United States. We're not even talking about the global space. Well, let's talk about Yale, where I am. Yale New Haven Health, or Smilow, is one center, but we are networked with a ton of other centers, right, across the state of Connecticut. And often when a sponsor comes in, they're only coming to Smilow, right? Same with Emory, right? And so now what bright spots are coming in, instead of just coming to the Emory main site, they're going to Grady, right? They're going to all of the affiliated places of care from a traditional site and better leveraging that site network. So that's another strategy related with success. I could go on, but you get the sense.
Yeah.
This is what we're studying now.